Hi everyone, welcome to this chilly evening. I don't know where everyone else is, but it's actually a little bit chilly here. So I've had to whip out like my proper warm knitted jumper. If you're here live, there's a bunch of you here already. Could you just give me a thumbs up in the chat or something that you can hear me and you can see me okay, and then we can actually get started. Yeah. Awesome. Okay. Thank you. Thank you so much, everyone. Yay. Well, welcome. I haven't been live in ages. Well, apart from the lunchtime session I did today, I haven't jumped in live and I've really missed it. I don't know. I did a whole bunch really close together and then I just had a bit of a break. So I'm so excited to be back here. And this topic is really exciting too because you all picked it. I did some polls on my Instagram a week or two ago, and this one was by far the most requested to just do a bit of a spotlight on these common sicknesses. I'm sure you've all heard of these ones before, if not already have had experienced some of these illnesses, but it's really interesting to see how similar some of these are, yet we treat them differently, which is, yeah, I find really interesting, but I sort of geek out on all that sort of thing quite regularly. So let's get going. Before we start, just for those of you who don't know who I am, my name is Penny and I'm a pediatric registered nurse. I also have a master's in nursing, which I specialized in, of course, pediatrics, because I will always stay nursing children. I absolutely adore looking after kids, but most importantly, I really do love the family-centered care that comes along with pediatric nursing. I really like caring for the whole family unit, whatever that looks like. It's never just one patient in on their own, unless they're teenagers, but they freak me out anyway. So I really, really love that part of pediatric nursing. I have also founded this wonderful business, Sick Happens, not quite 2 years ago. It has basically been created to fill in a bit of the gap that parents unfortunately have in getting information from trusted healthcare professionals that isn't a GP appointment or isn't an emergency or isn't a first aid course. So what I hope to achieve here with Sick Happens is giving parents preemptive evidence-based education with empathy, because I am a parent too. I know that what the evidence says isn't always possible, isn't always incredibly practical. So I do like to combine the two with everything that you need to know about dealing with sicknesses in kids and how to help your family through them, try and prevent them happening, but if they do happen, because sick happens, how we can support you through it with the practicalities of actually doing it, because it's all well and good for someone to sit at home and say, do this and this and this. It's like, okay, cool. Well, I have a newborn and a toddler and I've got, I'm sleep deprived and I've got to go to work in the morning. And it's like, right, we actually need practical tips to get through this. And that is exactly what Sick Happens does. This is my life, people. So many times I have people tell me, oh, being a pediatric nurse, your kids must be super healthy and you don't get sick. It just doesn't happen. Sick happens. Please don't feel like you are failing your family, you're failing your kids. If your kids get sick, unfortunately, it is just part of what happens in parenting. This is how kids start to strengthen and develop their immune systems. Obviously, we want to try and avoid it as much as we can, but it's almost impossible to avoid it altogether. This is me with my two beautiful boys. I have two boys. Rex is almost 6 and Jack is almost 4. We've been through gastro. That one in the middle there is me doing a wonderful poo inspection. I think at this point he was having really mucousy poos or something. So actually Rex took that photo of me. You can see my postpartum hair is absolutely strong. There's mess everywhere, doing a nice poo inspection. And then of course there's Jack with a fever. So I am honestly right there with you in this, because yes, I have the knowledge to know what to expect and how to get through it, but that's exactly what I'm here to do, is to help you, take you along the journey and know that you are not alone, because my kids get sick too. So these are the 4 most common childhood sicknesses that I come across. I have done lots of work I used to work at a pediatric only based emergency department in Sydney, and it was busy. It was very busy. I worked at triage, I worked in resus and all throughout the emergency department, and night after night and day after day, these are the most common illnesses that would come through those doors. Also, where I'm currently working, we see a lot of these illnesses because this is what we call the medical side of nursing, and that's my favourite. I really like medical because it's a lot of supportive measures, comfort measures, education, which I'm all about. And if you do follow my Instagram page, you would have seen that I gave a couple of clues with these pictures. They were way too easy. I need to make them a bit harder next time because you guys got it. You nailed it way too quickly. So what we're going to chat about today is bronchiolitis. I'm sure you've all heard it before. Croup, that barking cough, gastro, the poos and spews, and of course, hand, foot, and mouth disease. So strap in. Hopefully don't get too itchy. I do want to just mention, I know that you will have heaps of questions. I welcome questions. I love them. There is not one silly question, because if you are unsure, you can bet that there's someone else that is thinking exactly the same thing. So please, please ask me questions, but you can, pardon me, you can type them in now if you want to, if you're worried about forgetting anything, but I won't be dipping in and out of answering questions and doing the masterclass. I'll do the masterclass and then I'll answer all of the questions at the end if I can. It time dependent, but either write them in so you don't forget or just save them to the end. All right, let's get started with bronchiolitis. So I'm sure you've heard of this one before. It is what we call our baby cold. So what we're going to do is we're going to chat through what is bronch, how you catch it, how can you prevent it if you can, how we help support our little ones through an episode of bronch, and when do you get help. So I'm going to take it back to basics really quickly. I want to go through just the anatomy really, really briefly, because it will give you a much better understanding of what bronchiolitis is and why kids get the symptoms that they get. So obviously it is a respiratory condition. The most common mistake I hear is bronchitis versus bronchiolitis. Bronchitis is a little bit more of a older child / adult condition, and it happens up higher in the airways, so up here. Up here is all about upper airways. Down the bottom here, these are our lower airways. So you might have heard your GP mention in the past an upper respiratory tract infection. That's generally your cold, flu, snotty noses, coughs, or you can have a lower respiratory tract infection, which is what bronchiolitis is, because it's inflammation and infection down here in what we call the bronchioles. It is just part of the lungs. They're very, very, very small. And this is where we get swelling and we get lots and lots of mucus. So let's pretend that these are our airways. So the round airways, this is what we would call a normal airway, nice and open. Lots of airflow can come through. When kids get sick with an infection or inflammation, such as bronchiolitis, the airways get a lot more swollen like this, and they can get very, very small, which gives them that whistly noise like wheeze or noisy breathing. And then the body also produces lots of mucus to try and fight off that virus. So when you've got swollen airways and lots of mucus in those airways, it's really, really hard to breathe. So this is why our little tiny bubs struggle lots with bronchiolitis. So what are the symptoms in bronchiolitis? Well, it is an umbrella term. So think of bronchiolitis like a baby cold, like I mentioned before. So, when we get a cold, we can get a cough and a runny nose, body aches and pains, all of that sort of thing. Babies will get very, very similar, but there's a combination of symptoms. Your child does not have to have all of these symptoms to be given the diagnosis of bronchiolitis, but these are generally the symptoms that will point towards getting a diagnosis of bronchiolitis. So the first one is that little picture of a bub. So it is somewhat age dependent. It is grey, but roughly you won't generally get a diagnosis of bronchiolitis over the age of 1 to 2 years of age. So it's really those young bubs. So generally it's under 12 months of age, but sometimes if you get kids that are having bronchiolitis again and again, they will keep getting that diagnosis up until about age 2. But like I said, the actual age doesn't really matter, but it typically affects our younger bubs. They get lots of coughing, really snotty nose, lots and lots of mucus. You'll see them snuffly and snotty. They can also cough and gag up mucus from the throat and the chest. They can have all sorts of different symptoms of respiratory distress, so troubled breathing. I'm not going to be able to go through all of the symptoms of difficulty breathing in this particular masterclass, but I do have so many videos, posts and reels on my Instagram page, which is @sick.happens. There's lots of free content, but I do also have an online course, which I'll chat about later, which has an entire module dedicated to teaching you about signs and symptoms of respiratory distress, because this is ultimately, when a little one has severe bronchiolitis, they can have a lot of troubles with their breathing because their airways are swollen and full of mucus. You will also have an incredibly upset, irritated, cranky baby that doesn't really want to sleep very well. It can be quite stressful because you're tired, they're miserable, you're trying to get them to feed, you're trying to get them to sleep, you're trying to get them to breathe better, and it can be really difficult to do. Their feeds possibly could decrease, and this is simply because in our young bubs, to suck, swallow and breathe all in unison and in the coordinated rhythm is really quite hard to do, even when they're well. So if you get an illness, an infection like bronchiolitis, where they've already got a blocked nose or they're coughing lots or they just feel miserable, of course their feeds are going to drop off because either they don't want to feed or they can't. I put fever at the end. So a fever is 38 degrees Celsius or higher, regardless of the child's age. It is the same, exactly the same in any age child. What we do about that fever does vary depending on their age. The biggest caveat is if your little one is 3 months of age or younger, if they have a fever of 38 degrees Celsius or higher, it's immediately go to your closest emergency department. Just because they are quite little, they are quite vulnerable, and the risk of it being a serious infection can be quite high, and we just don't have the time to watch and wait. Our older bubs, so over 3 months of age, they have had that time to build up part of their immune system. They're a little bit stronger. They are able to cope with fever. But of course, you're going to be looking at all of their symptoms. And if they are, say, struggling to breathe or not feeding well, then that's the time that you would get help. But we'll chat about that a little bit later. So how is it spread, and can we stop that spread? So like I've mentioned many times, it is a virus. Bronchiolitis can actually be caused by many different viruses. So bronchiolitis, like I said, is an umbrella term. It's a combination of symptoms, but it is the actual virus that is causing those symptoms. So it's quite similar to croup, which I'll chat about later. So RSV is by far the most common one. I'm sure you've heard that before, but there are lots of other viruses. So for example, in coronavirus days, I'm sure that if a little one did contract coronavirus, yes, the actual virus causing the illness would be COVID-19, but it would be called bronchiolitis because the symptoms that they're getting fall under that umbrella term. So how is it transmitted? It's by a droplet, which means the infected particles need to be sneezed out, coughed out, licked, sharing drink bottles or anything where there's saliva or mucus that can be transferred. that's how it's passed on. So it doesn't just linger around the air. It's not an airborne virus. So it does actually need to be expelled out or transferred out. So the way to stop it being spread is by undertaking as best infection control as you possibly can. So hand washing is really, really important. I'll chat about hand gel in a little bit more detail when we talk about gastro, because there are certain situations where hand gel is not as effective, but with bronchiolitis, hand gel is okay, but if your hands are actually dirty, it's always best to wash them with soap and water. It doesn't matter what type of soap you use. You can use any back soap if you want to, or you could use shampoo. You could use super expensive Aesop soaps, whatever you want to use, as long as it has a surfactant, so it lathers up when you are washing it with water. You scrub, you use really good technique. I have a reel that I can show you later if you like. Otherwise, it is on my Instagram page of how to wash your hands correctly, and then rinsing it with running water is really, really effective. Please don't underestimate the importance and effectiveness of hand washing. So then what comes into it next is respiratory hygiene. So when you've got kids though, it makes it really hard because they're not going to cough into their elbow. They're not going to politely cough into a tissue and then place that tissue in the bin and then wash their hands. They are going to sneeze right in your face. They're going to give you kisses all over your face, which is really sweet, but not mixed in with snot. And this is how it gets spread around. Not to mention if you have multiple children, the older children that always have a snotty nose or a coughing are going to be all over your younger ones. You don't necessarily need to separate your children, because being in a family and having that sibling bond is super important. But perhaps maybe if they're old enough, you could teach them about how to perhaps not kiss them on their face, or teach them about how to sneeze away or cough away. But this is why lots of kids in the family will get sick at the same time, because it is really challenging to stop the spread. What you might find if you do have an older child and a younger child, like let's just say you've got a 6-month-old and a 2-year-old, your 2-year-old may just have a snotty nose and a cough, whereas your 6-month-old may get quite unwell with the symptoms I was describing about bronchiolitis, and they could really struggle and could end up being admitted. It's very likely it's exactly the same virus. It's just our younger bubs will struggle a little bit more just because they're smaller, they have less reserves, and of course they're still building up their immunity. I did, also washing down surfaces. You do need to clean first and then disinfect. I think a lot of people think if they just spray some Glen 20 or some spray and wipe, it'll be fine, but you need to clean everything down, because a lot of those anti-bac or antiviral cleaning agents will be deactivated if they're cleaning up food particles or things like that. Diluted bleach is probably your most effective at killing the viruses, but it is a bit of a moody chemical. It is quite, it can't be used on all surfaces. So as long as you're trying to clean, you're cleaning over those high touch points, and you're doing as best respiratory hand hygiene and hand hygiene, that's going to be your best bet in stopping the spread. So how do we look after a little one, that does have these symptoms? So saline drops are going to be your best friend. Please don't confuse giving your little one saline, either drops or sprays up the nose. It's exactly the same. It's just a different mode of delivery. Don't think that doing that is going to stop their snotty nose. All it's doing is breaking down the mucus particles in the nose to try and get it out. So what you may find when you start using saline drops or saline sprays is it may look like it's making their nose even more snotty, But what it's doing is, instead of it being really thick and blocked up in the nose, it's actually letting it run out, which is great because then you can wipe it away. They often sneeze it out, which is amazing because that actually, it's like blowing their nose, but they don't know how to do that yet. So sneezing it out is brilliant. The same with suctioning. I've got appropriate suctioning there because you can overuse suctioning. But those suction devices, battery operated, or if you want to use the one with the tube that you suck, if you want to do that, you can. I find it a little bit gross, but you do you. You can absolutely do that, and it is an incredible device to help clear your little one's nose, say before a feed, because we really want to make sure that they're getting hydrated. So doing some saline drops and some suctioning before a feed is amazing. It's perfect. That will really help them. But the aim of it is not to get them completely snot free. So you don't need to chase them around all day with a suction device to try and get all of that snot out. It's something that you do just need to ride out because if you're going around and you're suctioning all of the time, their body can start to produce more mucus, which will then, you'll just start chasing your tail, and that won't give their body time to resolve it itself, because it's so irritated. It will just keep producing mucus to protect their nose. And then you're just in this vicious cycle of snot and suction, snot and suction. So I love suction devices. They are amazing, but just use them just when you need. So in terms of feeding, this is really important. A dehydrated baby is going to be a lot more, it's going to complicate things a whole lot more, and they can become sick very quickly. So when you have a little one with bronchiolitis, you want to try and give them smaller but more frequent feeds. So whether that's breast or bottle, or if they're a bit older and they're already having solids and they're drinking out of a sippy cup or something, you just want to keep offering those fluids as often as you can, because chances are they probably won't want to take much. So let's just say you've got a breastfed bub. Let's say if they have a 15-minute feed is their normal feed, they may only be able to manage 5 minutes because they're so blocked up and they're coughing or they're pulling away because they're fussy. That is okay, but you then might need to offer it again in another hour or another 30 minutes, or go back to that demand feeding. Exactly the same with the bottles. If they normally have 150 mils and they only take 70, that is okay. Just offer more again and again and again. So ultimately you want to get whatever they normally have in a 24-hour period. You still want to try and hit those targets, but it may be smaller and more frequently. A lot more work, yes. A lot more tiring, yes. But if that means keeping your little one hydrated and supported and well and out of hospital, then, that's ultimately the aim. You do also, a way to check to make sure that they are getting enough feeds is to check their nappies, making sure that they are having a good urine output, so having enough wheeze in their nappy. But I could chat all about dehydration. That would take up an entire masterclass, so I'll have to touch on that another time. And then, of course, pain relief, cuddles, and comfort. They will probably want to sleep on you more, which again is annoying, but it actually supports them with their breathing, and having that reassurance and comfort is really nice. Don't forget pain relief. If you at all suspect that your little one is in pain, if they're old enough, paracetamol is amazing because it's very gentle on their tummies. If they're having this sort of baby cold, it's very possible they have a sore throat, or perhaps they're just feeling miserable. Please don't forget pain relief for kids, especially for babies, because they can and absolutely do experience pain. So just keep that one in the back of your mind. So how do you know when to get help? And the key here is knowing what symptoms are actually normal and when it's not. So when does it transition from becoming a normal symptom that we expect with an illness to, this is not okay, I actually need help? Do I need to see my GP? Do I need to go to emergency, or do I need to call an ambulance? And there are a lot of considerations here, like I mentioned before: their age, how much they're working hard to breathe, so what level of respiratory distress they're in, and of course their hydration. So I will chat about this at the end, because there is an incredible course that I have that teaches you how to assess your child for these symptoms and how to confidently make these decisions to be like, no, I'm not okay here. I'm not feeling safe. It's time to get some expert help. Okay, so the next respiratory illness we're going to chat about is croup. I've got my lovely seal there. If you've ever had a child with croup, you will know the seal is there because the croupy cough is, once you hear it, you will know it is a very barking, I don't want to say hoop because that would sound like whooping cough, but it's a very barking seal-like cough. So same as bronch, we're going to chat about what it is, how you catch it, how you prevent it, how we can help, and when to reach out and get some help. So I'm going to go back to this picture again because this is a really good visual in showing you the difference. So remember, bronchiolitis affected the lower lobes down here, so a lower respiratory tract infection. Croup actually affects the upper airway, so it's an upper respiratory tract infection. And it's called croup because, again, it's an umbrella term over a couple of symptoms, but it's the swelling of the trachea and the larynx, so the voice box and the windpipe. And similar to bronchiolitis, it does create swelling in the airways like this, and they can get, except it's up higher, and these airways up higher, much, much larger. And so if you picture a musical instrument, you know, when, I mean, I didn't play musical instruments growing up, but I do know basic concepts. But if you think about when you're blowing air through a musical instrument, the wider and the smaller the instrument is, it changes the tune. And it's exactly the same with our breathing. And this is why in these lower airways, when they're really, really small, when they're swollen and air is going through there, it's a high pitched sort of squeak. And that's what we call wheeze. Whereas when it's up high, because the airways are a lot, obviously not that wide, but they're wider, and they become more swollen, it's still not as small as these little squeaks down here, but you do get noisy breathing, and we call this stridor. I don't know if you've heard that word before, but that is a noisy breathing when you hear a little one breathing in and out, and it's like, yes, that sounded really amazing, didn't the face matched? You know that that's not a good sign. It is, it's actually quite dangerous because it is literally their airway swelling. And this is also why they get that really barking cough with croup. So let's talk a little bit about croup in how you catch it and if you can stop the spread. I do want to bust one little myth right off the bat, in that you can't actually catch croup, but you can catch the virus that is causing the croup. So like I mentioned before about bronchiolitis, so you've got your older child has RSV, they get a snotty nose and a cough, but then you might also get your younger baby, they get RSV, but then they get really sick and it's called bronchiolitis. It's very similar with croup too. So you might get a child that gets a particular respiratory virus and they go on to develop croup. So they get the swelling to the upper airways, they get the barking cough, they could get the really noisy breathing, so the stridor. But then you could also get their sibling that also gets a cough and a runny nose or something that doesn't actually go on to develop croup. So yes, they may have the same virus and that virus can be spread, but you can't actually, it's not a guarantee that if one child has that barking cough and the swelling to the airways, there's no guarantee that that's going to be passed on. So that's the key distinction, in that you can still, it's still an infectious virus, but it's not a guarantee that you'll get those symptoms of croup. So this is very similar. I won't bore you with this again because this is very similar to bronchiolitis. It is still droplet. It's the virus that's causing the croup-like symptoms is passed on with droplets, so sneezing, saliva, coughs, and exactly the same with infection control. The key to this is going to be hand washing and maintaining as best respiratory hygiene as you can. So how do you support a little one or a big one with croup? And I've got the very first thing to do here is keeping them calm. So if you've got a little one that is having troubles with their breathing, if they're becoming really stressed, if they're becoming really worked up, it will make their breathing worse. So trying to talk to them and keep them calm, even if this means an ambulance is on the way or you're about to go to emergency, because it always happens at night. I don't know about you, but so many of our croup cases would come through in the middle of the night. You would put them to bed, they'd be fine. And then all of a sudden, you'd wake up in the middle of the night to really loud barking, barking cough and that troubled breathing. Again, nothing that you've done wrong. It's just part of, it's potentially the cold air that is making their airways a lot more reactive, and then they can go on to develop those croup symptoms. So keeping them calm is really, really important. The next thing is making sure that you are as knowledgeable about signs of respiratory distress as you can, because this is key. Because if you've got a little one with croup and they've just got that barking cough, they don't necessarily need emergency treatment. But if they're having signs of respiratory distress like that stridor, so the noisy breathing, or if they're showing signs of respiratory distress, that's when you really are going to need to get them help. And this is what we chat about in the online course, Normal or Not. I did want to pop in here, so many, I don't know the statistics. You'll have half of the parents saying, put them in a hot shower and steam up the bathroom. And the other half will say, no, wrap them up and take them outside in the cold air. There's actually no evidence either for or against either of these options, but there's probably not going to be any harm in trying, as long as it doesn't take over getting medical attention if they do need medical attention. So many times parents would wake up in the middle of the night, have a really bad croupy cough. They'd bundle them up, they'd take them to emergency, they'd walk through the emergency doors and be like, I promise you that they were well before, they were sick before, and they're sitting there as happy as, and it's possibly the cold air, we're not sure, but we do believe you. I promise we believe you. So again, one thing I wanted to mention was some kids will get croup over and over and over again. It's possibly an anatomical predisposition, so they may just have more reactive airways, and when they get those respiratory viruses, they go on to develop croup. If this is your little one, they will probably most likely grow out of it, but I would recommend that you chat with your GP to see if you can get a specific plan for your child so that you can have some medications at home if they feel it's appropriate. I don't diagnose or prescribe, but if they feel it's appropriate for you to have those medications at home, it may save you a trip to emergency. But like I mentioned before, if your little one does have signs of respiratory distress, even if you had the medicines at home, you do need to seek medical attention. And this is why I created an entire module on breathing, which I'll chat about at the end. All right. How are we all going? We're still good? Yep. Yes. Yeah. Okay, cool. So gastro, the poos and spews. It's almost like this parenting thing you have to go through to be like, tick that off the list. Yes, we all survived gastro. This is one of the biggest phobias a lot of parents do have, is vomiting. I know my husband definitely gets quite worried when the word gastro is mentioned. If we ever get an email from preschool saying there's been a confirmed case of gastro, it's like, ooh, panic. And that's fair enough, because it is very, very contagious and it is incredibly unpleasant. You know my backstory. I had really horrible pregnancies, I had hyperemesis, and yes, definitely have had enough vomiting and to serve my whole life quota of vomiting. So I definitely don't want gastro. Okay, so here's some more visuals for you. Technically, gastro is actually inflammation to the lower intestine. So diarrhea is if you go by the textbook, they need to have diarrhea for it to be gastro. But for kids, they can have just vomiting too. So it could be vomiting or diarrhea, plus lots of other symptoms, such as they can get a fever, they can get tummy pains, they can have just the nausea. But generally speaking, if they're vomiting and got diarrhea, it's most likely gastro. If they're just vomiting or just diarrhea, there are a couple of other things that it potentially could be. But I always say to parents, please don't worry about trying to diagnose your child. Just treat the symptoms and learn how to recognize concerning symptoms in kids. And with gastro, it's going to be mostly keeping their pain under control and keeping them hydrated. That is going to be the biggest thing for gastro. So yay, this is the first one that's not just a virus. Viruses can cause gastro, but there's also fungus, parasites, bacteria. Unfortunately, there's a lot of things that can cause stomach upset, and that is purely because it's actually really clever the way the body does this. But if they get some sort of a pathogen, so a germ, a bug, it wants to try and get it out. So it literally just tries to expel it from either end. So it will vomit and diarrhea it out, and it just increases the movements along. It's called peristalsis, where the muscles will squeeze to try and move food down and around the bowel and out, but it will just start spasming to try and get it out either way, because it just goes into protect mode. So this one is a little bit different. Yay, again, something different. These pathogens, so these germs, will be passed on via contact. So how that works is if someone's infected with the germ, it will be passed on via vomiting or fecal matter. But there is a time before you have symptoms, so you can be infected with the bugs and you don't realize it yet. You can still pass that on via contact, but it has to be sort of like through saliva as well, and it's passed on that way. But it's much less likely to be passed on that way. It is more likely to be when they're vomiting, when you're cleaning up dirty nappies, not washing your hands well enough, or the biggest thing is if you don't isolate for long enough after a case of gastro. So if you don't isolate for at least 24 up to 48 hours after the last symptom. So that's the last episode of diarrhea or the last vomit or the last fever. You want to be isolating for up to 48 hours. Most preschools and schools will say 24 hours, and I don't make the rules. I'm not entirely sure why, but if there are lots of cases of gastro in your child's school or preschool, they will up it to 48 hours if it's been declared an outbreak. So for us personally, we will stay home for those 48 hours because it's just so gross, and we definitely don't want to pass that on. Because again, this is a contact transmission, you want to be really cautious of those high touch points. So cleaning light switches, cleaning remote controls. What I normally do with my kids is if someone starts vomiting and diarrhea, I will quickly grab just a couple of toys. I'll put that in its own little basket and say, right, you are isolated to use those toys. And then I'll do a bit of a clean. So if they're plastic, I can chuck them in the dishwasher or in the bath with bleach if they won't be affected by the bleach. I do actually have a bunch of posts on my Instagram page, plus I chat about this a lot in our course to teach you how to do a proper clean, because gastro is really contagious, and the last thing you want is to go down with gastro yourself and have to care for children that are vomiting too. It's not fun. And yes, I've done that before and it's not fun. So how do you support your little one that's going through gastro? Number one thing is going to be fluids. Please don't worry if they're an older child. So if they're well and truly into their solids, Don't worry if they don't want to eat. In fact, I would probably hold off on eating a little bit when they're actively vomiting. But you really do need to focus on fluids, anything they will take. So if they're breastfeeding, that is amazing. That is really great. If they're formula feeding and they're able to keep it down so they're not vomiting it back up, then keep going with that. But if they are still vomiting that up, then if they're old enough, so if they're over 6 months of age, you can switch to oral rehydration solutions, so things like your Hydrolyte and Gastrolite. But for young, so bubs sort of under 12 months to 6 months of age, I would have a low threshold to go and seek medical attention because they are really little. They can get dehydrated quickly, and you just want to be catching up and making sure that they are actually okay. But again, like I mentioned with the bronchiolitis, small frequent sips. So I would even go smaller when they're vomiting or they have diarrhea. You want them to have little sips, but frequently for the body to have the opportunity to absorb the fluid before it's vomited back out. My boys do this too, but if they're super, super thirsty, they'll scull, and then they'll just vomit it all back out. And you're like, that was a waste. I mean, it feels nice to have a really big drink when you're thirsty, but it doesn't actually hydrate you at all. Ice blocks are fantastic if they're old enough because you can actually absorb some fluid through the mucosa in your mouth. So especially if it's with sugar, the sugar actually helps the absorption. So sucking on an ice block is great because it's really slow into the system and it doesn't actually give the body much of a chance to vomit it back up. So that's a really good one to have. Pain relief, it can be, those poor tummies can be really super sore. So don't forget things like paracetamol. You can do ibuprofen if they are in pain, but if they're not eating very much, it's probably a better idea to withhold the ibuprofen for a little while because it can really irritate their gut. And there has been cases of bleeding in the gut if they've had lots of doses of ibuprofen on an empty stomach. So the one-off would be totally okay, but yeah, I would probably just try and stick to paracetamol and see how that goes. Like anything, yes, learn the signs of dehydration. This is really, really important because the signs of dehydration are going to be different, say, in a baby to a little crawler and then a preschooler. They all look a little bit differently, so it's really important to learn those signs of dehydration. And yes, this is what I do in the course, in my online course, Normal or Not. I have an entire module on poo and I have an entire module on vomiting because that's how much I love to talk about poo and spew. No, because it is, in this masterclass, I really like giving you the symptoms of particular illnesses. But if I was going to do that for every single illness there is out there, there's a lot, right? And we don't ever expect you to be able to diagnose. That's why we have doctors. They've had all of those years and years of medical training. Let's outsource that. What I would really love parents to be able to do is to be able to recognize when symptoms are normal and when symptoms are not, because you can see that there's so many of an overlap of symptoms in all of these illnesses. So what I would rather parents be able to do confidently is be like, yes, that's okay to stay at home. And like, no, we need to get help here. And that is exactly what my online course does, is it really gives you that confidence to be able to pick up when something's not quite normal, when to get help, what questions to ask your doctors so that you can feel really empowered and really confident in caring for your sick kids, because sick happens. All right, last one. How are we going for time? Amazing. Plenty of time. Hand, foot, and mouth. This one will probably make you itchy. I've got some great visuals for you. Same story. What is it? How do you catch it? Prevention and how to help our little ones. Here are some pictures for you. What I'm trying to show you here is not to be like, oh, let's match these pictures up with your child and then you can diagnose, but This is a really great visual of showing you how different it can look in kids. These little ones at the top here, so these oval shaped blisters, that's the textbook hand, foot and mouth. Quite obvious. They start on the hands and the feet and can have ulcers in the mouth. But I really love this picture here because this shows you that it's not just exclusive to the hand, the feet and the mouth. It can be all over the body. And even this one, I mean, there's a couple of blisters here, but even this one, sometimes they can be misdiagnosed as like a viral rash or a heat rash, particularly if you have a little one with eczema or dry skin. It can look even different in there. So I think bottom line is if you've got a rash, they've got a sore mouth, keep this in the back of your mind, but just always go and see a GP because you can get a swab to confirm hand, foot and mouth, or they've seen so many cases in kids that they'll be able to tell you what it is. I also did want to point out, this is where this picture came from. It's called Skin Deep. Don't forget the bubbles. And it's amazing. I believe it's a website and an Instagram page where they're collecting a whole bunch of pictures of skin conditions, but they're not just having it of children or adults with lighter coloured skin. So they're getting heaps of pictures for kids and adults with darker coloured skin, because traditionally we only ever had medical images of people with lighter coloured skin, and that's just not representative of the population now. So if you, it's really great to be able to scroll through and see just how different they look just on different coloured skins. It's really interesting. So this one is spread, it's again a virus, surprise, surprise. There's two main viruses that cause hand, foot and mouth, and that is the Coxsackie virus and the enterovirus. You can get it multiple times, unfortunately. There used to be a bit of a myth. I sort of was like, of course you can get it multiple times, but no, there was lots of people asking me, yeah, but once you get one case, you won't get it again. Unfortunately, that's not true. You can't predict if it will get worse or better each time. It's really annoying. But this one seems to have the trifecta of how it's passed on. So it can be passed on in the feces, so in the poo. It's passed on with nasopharyngeal secretion, so that means nose and the back of the throat, so basically snot and saliva, and also the blister fluid. So if ever those little blisters on the skin pop and fluid leaks out, it is very contagious. And this is why it will say, most infection control policies will say at schools or preschools that you can't come back until all of those blisters are either gone or well and truly crusted over. The actual rash can linger for quite some time, you know, a couple of weeks, but we don't expect kids to stay at home that whole time, as long as they're not having any fevers, any runny poos, and there's no fluid coming from those blisters, then because it's all crusted over, that should be fine. You do need to double check with your doctor in terms of snotty noses, because you can get hand, foot and mouth and a cold at the same time. You're like, which one is this? Is the snotty nose from hand, foot and mouth or a cold? It can be really confusing. So definitely keep chatting with your GP as to finding out, you know, how long to isolate for and when you can go back to school and re-enter society. I always say, pardon me, any rash, particularly with a fever, which hand, foot and mouth generally has, please go and see your doctor just for infection control, like a diagnosis. You want to be able to find out what it is. If it's something like a post-viral rash, then you may not need to isolate, but something like hand, foot and mouth, absolutely do need to isolate. Fluids, of course, is incredibly important because if they've got spots in their mouth, if they're really sore in their mouth and their throat, it's going to hurt and it'll be really challenging to get them to drink. So approach it sort of similarly to what you would have done with all of the previous things that I mentioned, in small frequent sips. Ice blocks are amazing because they can numb the throat and the mouth as well. Have a chat to your pharmacist about numbing gels. I am wary of recommending them because they have been linked with incorrect use, and they can lead to respiratory issues. But when you've got kids with really sore mouths and throats and they're not drinking, you've got to sort of weigh up pros and cons about the risk of having some difficulties breathing and the risk of becoming dehydrated. This is not something that I would say do or don't do. I just want you to recommend chatting to your pharmacist to say, is this appropriate now? They're an amazing resource, PS. They have so much knowledge. If you can't, I'm not saying replace your GP with a pharmacist, but please don't forget about your pharmacist. They are amazing. So if you've got a little one that's struggling to drink with hand, foot, and mouth, please go and chat to them and see if there's anything that you can try. They're very helpful. But absolutely keep up pain relief. Paracetamol, ibuprofen is fine. And then, of course, like anything, learning the signs of dehydration is super, super important. So with hand, foot, and mouth, it's very rarely the rash or the illness that causes most of the it's the complications that cause the problem. So the dehydration is the biggest thing, or pain. And yes, we have an entire module on rashes in the normal or not online course, which is definitely what I want to talk about now, because how on earth do we know what's normal in kids? We know that kids are all different, especially with things like when you've got a first aid course, for example, you're talking about accidents and injuries. There is some really great step-by-step things that you need to do that are really important and really, I wouldn't say easy to learn, because it's not necessarily easy when you're in the thick of an accident or an emergency and you're trying to remember it. But when you're talking about sicknesses, it's very grey, it's different. You're like, ooh, but is that quite bad? Oh, but are they breathing worse? Or how dehydrated is dehydrated? This rash, well, it started there and it spread there. It's very confusing, and it's a lot of pressure to put on parents, which is exactly why I created my Normal or Not course. What I do in this course is teach you through the 7 modules. So I try and focus you on learning the symptoms so you can apply that knowledge to any sickness, rather than teaching you everything you need to know about each sickness. So we go through fever, breathing, so that means signs of respiratory distress in kids, so signs of troubles breathing, rashes, vomiting, poo, recurrent illnesses and immunity, so how can we support their immune systems? How can we strengthen their immune systems? What does the evidence say? Is there evidence for supplements? And then, of course, case studies. We go through a lot of case studies both in the course, and I'll show you a little bonus we have where we practice all of these skills that we've learned. We go through some case studies where we're like, okay, what would you do in this situation? Have you thought about this? So it's really practical in giving you those skills. So there's lots of audio, there's lots of video footage. We're very, very lucky to have had parents share videos that we can look through and learn from. There is a downloadable workbook if you prefer to read. There's lots of refreshers in there. And then my favorite part is a private Instagram page attached to the course. So you get bonus resources from me. I jump in there a lot to do live Q&As. Basically, you ask me what you want to learn more about, and I do that. So it's like this ongoing refresher, this ongoing troubleshooting, case studies forever. I probably should say forever, because it's via Instagram, and I don't own Instagram, but it will be there for as long as Instagram is around. I do have a little sneak peek here. I'll just move my head across. This is a little sneak peek into the private classroom. I don't double up on from my public page, so it's not just public page posts over here. Unless there's one particular post or reel that the parents in the private classroom have liked, but this was my family going through gastro. So I walked through and I told everyone how I cleaned, how I handled it, how I helped Jack to drink better. Like, yeah, it was not fun, but great for everyone else. So this is actually my favorite part of the online course, is this private classroom, because there is so much bonus content in there. Plus you get priority access to my DMs. So you get to ask me questions, which is really, really helpful. So if you're interested in joining the Normal or Not online course, the doors are now open, which is very exciting. We'll have a bit of an Alexa moment. And if you do sign up in the next 48 hours, you will get access to the Ultimate Immunity Collection for free, because I like giving freebies away. This is an e-guide. It is over 60 pages of everything you need to know about handling those common winter illnesses, snotty noses. I go through all of the evidence for supplements, how to teach your kids about maintaining effective infection control. So this is really great if you've got toddlers or preschoolers where you're trying to give them information about not to lick their baby brother or sneeze on their baby sister's face. It's really great. Enough from me. I've spoken enough. I'm going to hand it over to you. So I am going to, I've got questions in 2 different areas. So, okay, I'm just going to bounce between. So if you've got questions, start writing them in the question box now, and I will just start going through. So the first question we have from Emily is, how can you just determine a respiratory virus or croup from asthma? Oh, really great question. So I like to explain asthma as a chronic condition. It's also an immune condition. So the same as croup and bronchiolitis, you need to get a virus to then trigger off that infection, that inflammation process, and then you get the symptoms. With asthma, it's a little bit different. Yes, viruses are a trigger that can trigger off an asthma exacerbation, but there's so many other things that could do that. So with asthma, it could be things like hay fever, or exercise, or the environment, or it could be their emotions. There's a lot more, it's a lot more complicated, a lot more complex in what triggers off a flare-up of their symptoms. So with asthma, you do have, it can be treated with a couple of different medications, but unfortunately with asthma, you need to have a little bit more of a history, a bit more of a background. So tracking symptoms is really helpful to find out what the triggers are for your little one. Yeah, it's a little bit more complicated. If you have any other questions, just pop it in. What is best to use paracetamol for ibuprofen? Okay, so I think paracetamol is a really great starting point. It is a really great pain relief. They actually don't know the exact mechanism of how it works, but we know it provides pain relief. Ibuprofen is a pain relief, but it's also part of a family of medications called non-steroidal anti-inflammatories. So yes, it provides pain relief, but it also provides, it's an anti-inflammatory as well. So it is great for things like ear infections where there's swelling, tonsillitis where there's swelling, or if you've got muscular aches and pains, it's really good for that. Teething, because it's swollen gums. They can absolutely both be used together, but their timings of how frequently you can give it are different, and paracetamol can only be used up to 4 times in a 24-hour period, whereas ibuprofen is 3. So if you are switching between the 2, I highly recommend you write it down. I do have a medicine tracker magnet for this that you can pop up on your fridge. It's got safety nets of max doses in 24 hours, so you can't overdose, or at least makes it much, much harder to overdose. So yeah, that's sort of the basis of what I would use paracetamol and ibuprofen for. Okay, can the common cold lead to bronchiolitis, or is it something that you just catch? Yes, a common cold can absolutely lead to bronchiolitis in kids. So I mentioned that in the masterclass, in that it could be exactly the same virus spreading around the family, whereas your little tiny 4-month-old may get bronchiolitis, but your primary schooler just gets a snotty nose and a cough. So yeah. Can too much suctioning cause nasal abrasions? Yeah, if you're quite aggressive with your suctioning, yeah, you absolutely can. You can cause bleeding. It can be really uncomfortable. You can cause little sores in their nose. So it does need to be used with care, and you don't want to be like really jamming it up there. Just try and get it out. Sorry, did I miss how much the normal and not course was? Oh, sorry. No, I didn't actually tell you. So the price remains exactly the same. It's $297. But if you do sign up in the next 48 hours, you get a free copy of the Ultimate Immunity Collection, which is over $40 worth, as a bonus. So the actual cost of the course remains the same, but you do get a little bonus freebie by signing up in the next 48 hours. I've heard hand, foot, and mouth is not a concern to adults catching it, but what about if you're pregnant? Yeah, so if you've ever had hand, foot, and mouth as an adult, it's sore. I personally haven't had it, but I have had some friends that have had it, and apparently it is quite painful. Any illness whilst pregnant, I would highly recommend chatting to your OB or your midwife. I don't know. I'm not a midwife, so I don't know. I'm not up to speed on everything about which viruses are concerning or not. If you had hand, foot, and mouth, or if your kids had hand, foot, and mouth, I would at least just mention it to your midwife or your OB to find out if there's anything that you need to be more cautious of. Yeah, I don't know. I don't have all of the knowledge around that. Sorry. How long are you immune from each of these illnesses once you've had them? Could you be reinfected with gastro, foot and mouth? Yes. Unfortunately, I don't know exact timeframes. I know with something like common colds or bronch, viruses mutate incredibly quickly. Same with gastro. So you could become you could have an illness and then you could have a bit of time off, and then it could have circulated around daycare and mutated and come back, or you can catch the same one again, which sucks a lot. But I can't give you an actual time frame, because there has been times where I know my friends have had gastro after gastro after gastro, and it's really crappy. If that is happening, I would look into just how you're cleaning, try and up that. But I don't say that to say it's your fault. You're doing something wrong, you're not cleaning. It's not that at all. It's just a really crappy part of sicknesses in kids. Will you be releasing a health tracker for 2022? Pretty please. Yes, I will be. I'm really hopeful that it will be out before the end of the year. We have made a bunch of updates to this one. For anyone that doesn't know, this is a symptom tracker that I had. It is part education, so it's like a little tiny mini textbook at the front, and then at the back it has a whole bunch of ways that you can track your child's symptoms. You can track their fluids, you can track their medications, allergenetic food tracker, so you can tick off when you've given them eggs or cow's milk or all the different types of nuts, so that you've got everything in one spot. You don't have to rely on memory, because we all know that our memory sucks once you become parents, and you can take that to your doctors and be like, this is what's happening. So yes, we do have one coming out. Okay, just a couple more questions here. When you're giving paracetamol with gastro, how do you know how much they're getting if they're vomiting and pooing? Yeah, do you have to just give the recommended dose and then wait the allotted time? Yes. So there is absolutely no way to know how much they have absorbed when they're having diarrhea. As for vomiting, we usually give them a 10-minute window for vomit. So if you've given them a dose of a medication, any medication, if they vomit within 10 minutes and it's a decent vomit, it's not just like a little spit, you can repeat the dose, but we only allow, in the hospital setting, this is what I'm talking about, we only repeat the dose once. If it's after 10 minutes or they're just spitting little bits out, we won't repeat the dose because there's no way of knowing how much they've had. So we just have to take it as that's that dose done, and you wait. So if it's paracetamol, you wait another 4 to 6 hours to be able to repeat it again. But yeah, it is really tough because when they are vomiting lots, they might be in pain. You want to give them pain relief, but it may just not be working. So you've just got to wait. If you could chat to your pharmacist about suppositories, so the paracetamol medications that go up the bottom, but we were in like a national shortage and there was none anywhere, which is a bit sad. But yeah, so 10 minutes and only repeat it once. And then one more. How long should gastro last? You did say you can just have diarrhea. Yes, so gastro, you can have just diarrhea or you can have just vomiting. How long would it last? Varies. Hopefully it only lasts sort of, vomiting usually only lasts about 24 hours of that severe, constant, can't keep anything down. But it isn't uncommon for kids to have diarrhea on and off for a couple of days, or they could be sort of vomiting on and off for a couple of days. It is quite varied. And also something to add as well is it's also not uncommon for anyone, adults included, to have a temporary lactose intolerance after a case of gastro. So they can get a really inflamed gut. So then they could be totally recovered, but then you notice that they're having diarrhea or they're having the occasional vomit after having foods with lactose, so dairy products. You would need to have a chat to your GP to make sure it's not actually lingering gastro, but that can happen and it can take a couple of weeks for the tummy to heal itself and settle back down. And it's only a temporary intolerance. It's not going to be lifelong, but you can get pain and vomiting and diarrhea after vomiting and diarrhea, which makes no sense, but it can happen. Now, I think that was all, and I know that I don't want to take up your entire evening. I will send you a recording of this, especially for those that can't make it live. I will send a recording. If you have any questions at all about the online course, please email me. My email is hello@sickhappens.com.au. You can also DM me via Instagram, but I highly recommend, or can I please suggest, that you put online course in capital letters at the start of your message, because it gets a little bit overwhelming in my messages. And if you have it in capital letters saying online course, I'll know what you're about. I'll be able to jump in there and help you. But thank you so much, everyone. I'm so happy to have you here. And thank you so much to, who was it? Sophie, who helped me with my amazing tech fail, because I never know what I'm doing here. And you can all just read my emails. Thanks, everyone, and have a wonderful evening. Bye.